Most patients with acute maxillary or frontal sinusitis are treated at healthcare centers or by private practitioners. Suspected sinusitis, based on case history and clinical findings, can be rapidly and reliably diagnosed by ultrasound without X-ray examinations. The evaluation of treatment results is also simpler by ultrasonography. The echoes can be seen on a light-emitting diode bar display. The upper part of the display shows a general-purpose 8 cm scale. The lower part features a 4 cm depth range for scanning frontal sinuses or examining the maxillary sinuses of children under 7 years of age. Ultramax is switched on by pushing the on button. The 8 cm range is now automatically selected. A little ultrasound contact gel is applied to the tip of the probe. When examining the maxillary sinuses of adults, the patient's head must be held in an upright position. The tip of the probe is pressed tightly against the anterior wall of the sinus. The lower margin of the probe should be level with the base of the nasal cavity, with the probe itself gently touching the side of the nose. Special attention should be paid to keeping the tip of the probe tightly against the anterior wall. False back wall echoes may be found if the probe glides to the orbit area, the lateral or medial walls of the sinus. Whilst keeping the tip of the probe still, the device is swiveled in search of a back wall echo. In most cases, the best reflections are found by pointing the probe in a slightly medial direction. A back wall echo indicates a sinus with retained exudate. A back wall echo is always preceded by an echoless region on the display. The findings may be shown to the patient by pushing the freeze button and by keeping it depressed. The cavity is free from exudate if during thorough examination only an anterior wall echo is encountered. The maxillary sinus of a child is smaller, and the floor of the cavity lies higher than that of an adult. In children, scanning is therefore started about 5 mm above the level of the nasal cavity floor. Special attention should be paid to keeping the probe tightly against the anterior wall of the cavity. In children under 7 years of age, the 4 cm scale should be selected. When scanning adult frontal sinuses, observe the following points. The 4 cm scale is selected. The contact gel is applied. The patient's head is tilted backwards 30 degrees in order to detect the smaller amounts of secretion. Scanning is started at the floor of the cavity, near the mid-sagittal line, level with the eyebrow. The expected depth of the back wall echo is approximately 2 cm. To acquire the right examination technique, the following points should be kept in mind. When scanning maxillary sinuses, the patient's head should be upright in order to prevent any secretion from flowing towards the back of the cavity. It can be seen in this schematic model that the continuity of the fluid between the anterior and posterior wall is interrupted when the patient's head is tilted backwards. When scanning frontal sinuses, however, the patient's head must be tilted backwards 30 degrees so that the exudate forms a connection between the anterior and posterior walls. The shape and position of the sinuses should be kept in mind in order to avoid false echoes from the orbit or the soft tissue around the cavity. A sinus with retained exudate produces a clear back wall echo preceded by an echoless segment on the display scale. Any other type of finding indicates that there is no exudate in the cavity examined. According to Finnish, Swedish and German studies, 8 or 9 of every 10 cases of suspected sinusitis can be confirmed or excluded using ultrasound.